Now I'm going to palpate the anterior and posterior thorax, and I'm looking for if there's any pain in this areas. And then after that, I'm going to check all the valves. Okay, now I'm going to ask you if there's any pain.
No.
Okay. Now I'm going to check. The first one is aortic valve, is second intercostal space. It's on the right, second intercostal space on the left is the pulmonic valve, and on the right below the sternum on the fifth intercostal space is tricuspid. And I'm also going to palpate his apical pulse right here. And then I'm also going to, another name for that is the mitral valve. It's the fifth intercostal space. Is it check for pain? Is there any pain?
No.
Okay. Now I'm going to auscultate the chest, and I'm listening for murmurs or in the rhythm of his heart. Okay, and now I'm going to auscultate his lungs, and I'm listening for if he has any wheezing, gurgling, friction rub, or crackling. I'm going to ask you to take a deep breath in. Take a deep breath in. And let it out. Breath in. Out. Okay. Breath in. And out. Breath in. Out. Take a breath in. And out. Breath in. And out. Take a 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 breath in. And out. Good. And if I heard any of those things, I would go back and use 99 as a confirmation for any of those tests. Next, I'm going to move to the abdomen. I would ask the patient to empty their bladder before I would do this. All right, let's have you lay on your back, please. Right now, I'm inspecting. I'm looking to see if everything is symmetrical, if there's any distension. This umbilical cord is, umbilicus is in the center. Okay, next I'm moving to the abdomen. I would ask the patient to go empty their bladder before I would begin this exam. Can you please lay on your back? Now I'm looking for any kind of distension, any pulsations, the contour of his abdomen, making sure everything is symmetrical. Next, I am going to auscultate the abdomen. I'm going to listen to his bowel sounds, and then after I listen to the 4 quadrants, I'm going to go to the abdominal aorta to see if there's any swishing noises, listening for breweries. I'm going to switch to the bell for the abdominal aorta. Yes, now I'm going to do the palpation of the abdomen. I'm going to ask the patient if they have any tenderness. I'm going to feel for any large organs. If there's any tenderness in any of the area, I'm going to do a rebound tenderness test. Is there any pain?
No.
Pain?
No. No.
No pain?
No.
Okay. Now I'm moving to the lower extremity. The first thing is I'm going to do is I'm going to check his pulses. I'm going to go to the femoral pulse. I'm listening to the, feeling for the rate and rhythm. Good. I'm going to do his popliteal. And his pedis. Good. Now I'm looking at his skin, his texture, and also the feel of his temperature. I'm also looking at his leg length. It should be equal. If it's not, I would have to measure it out. Also, I'm going to do his capillary refill. Good. And it should come back within 2 seconds. Let's have you sit up, please. Next, I'm going to check some reflexes, his patella. Good. And then I'm going to check his Achilles. Good. And then also, I'm going to ask him to do some muscle testing. Hold your leg up. Resist me. Don't let me push it down. Good. And then I'm pulling it out. Resist me. Good. And then I'm also going to feel if he has any edema. Good. This concludes my head to toe assessment. Thank you.